Well, hello again. Welcome to the third PowerPoint, the concept of acid-base balance. A patient is admitted from the emergency room with tachypnea. Appears to be anxious. The client has a history of anxiety attacks. Admitted to the step-down intermediate care unit for close monitoring. The patient has the following ABG results: a pH of 7.54, PaCO2 of 31, bicarb 21 or HCO3, and a PaO2 of 84%. Are the blood gases normal or are they abnormal? Based on the current information in the patient's history, the nurse may assume that the patient is experiencing which acid-base imbalance. Looks like respiratory alkalosis to me. What about you? What is the cause? The patient may not be critical at this point, but could become critical if the cause is not corrected. So now we are going to look at the other end of the scale. So we talked about respiratory acidosis in the last PowerPoint lecture. Now we're going to look at respiratory alkalosis. And so again, we need to look at the pathophysiology before we can begin to look at the pieces of respiratory alkalosis. So the pathophysiology includes respiratory alkalosis, almost always caused by hyperventilation. So remember, this patient has had some type of decrease in CO2. So like in hyperventilation, they're blowing off too much CO2. So there's not enough CO2 on board in the body. So there's a deficit basically of carbon dioxide. Remember, the body likes balance. So we've been talking about balance. We'll continue to talk about homeostasis. Again, the body likes balance. So the common causes, most likely respiratory alkalosis, is due to hyperventilation. And again, it's blowing off too much CO2. It leads to a decreased level of CO2 in the body. Other causes do include infection, excessive mechanical ventilation. So this could be that we have someone who's on the ventilator in the ER or in the ICU setting or the PACU post-op area, and the ventilator is set. The respiratory rate on the ventilator is set too high for that particular patient. So that just means that the ventilator is working for them, but it's blowing off too much CO2. So this is when we have to make changes to the ventilator to help bring that CO2 level back into a normal range. The respiratory center stimulation from fever, salicylate intoxication, aspirin. Really what aspirin does is it causes an effect on the respiratory center. So it causes the patient to go into like a hyperventilation state and they blow off too much CO2. And so then it can also cause trauma to the central, trauma to the central nervous system could cause your patients to go into respiratory alkalosis. So the most significant lab values would be a pH greater than that 7.45 or greater than that 7.4, which is that norm. But generally, these patients have a pH of that's greater than 7.45. And also the PaCO2, you'll find that it's less than that normal value of 35. So that tells you that they're more on the alkalotic side, right? Because remember, CO2, the greater that number, the more acidic, but the less that number is, the more alkalotic. So compensation does occurs by the kidneys. And that just means that the kidneys will help to conserve acids and then also excrete bicarb. So at this point, it's going to try to get rid of the bicarb instead of retaining like it did in acidosis. It will begin to excrete it more so. So this is when you guys will see like a lower bicarbonate level, generally less than that 24 milliequivalents per liter. And that gives you an indication that the body is trying to compensate. Again, remember I talked about hyperkalemia and respiratory acidosis. The opposite effect happens in respiratory alkalosis. The patient may develop hypokalemia and also along with that hypocalcemia, so low potassium and low calcium levels. And this is again secondary to the exchange of hydrogen ions, acids, and potassium at the cellular level. Okay, so clinical manifestations. We always have to look at clinical manifestations. How do you even know that your patient may be experiencing respiratory alkalosis? So we always have to look at what are some signs my patient may exhibit. So clinical signs that your patient may have in respiratory alkalosis do include, again, hypokalemia. This is the opposite of respiratory acidosis, where hyperkalemia may result. So that potassium moves from the cells to the extracellular fluid in exchange for hydrogen ions. So this is why you see that lower potassium level. Chefstick sign or Trousseau sign, we talked about that in the concept of fluids and electrolytes. And this is generally due to the effects of that low calcium level. Okay. Myocardial irritability, increased heart rate, dyspnea, which is a difficulty in breathing, dizziness, anxiety, panic, seizures, blurred vision may happen with these patients. Vasoconstriction. So remember, in respiratory acidosis, the patient can experience vasodilation, but these patients in alkalosis, because of the CO2, the effects that the CO2 level has in the body, they generally tend to have vasoconstriction instead of that vasodilation. And so this does cause a decrease in the cerebral blood flow, and it results in the patient feeling like they're lightheaded, alterations in mentation, and or unconsciousness. So priority nursing assessment. Monitor the patient's clinical manifestations. Okay, do they have clinical signs of alkalosis, respiratory alkalosis? Monitor the ABGs, the lab values, especially potassium and calcium. Those things will need to be reported if needed. Monitor the ECG. Remember, because of the hypokalemia, they could have cardiac dysrhythmias, and the hypocalcemia could cause cardiac dysrhythmias as well. Monitor the neurological status secondary to the CO2. Work collaboratively with the primary care team to find the cause and correct the cause. And remember, generally it's caused by hyperventilation. Assess the lung sounds, the respiratory status, assess their cardiac status. You want to look for like an increased heart rate, increase in palpitations. Treating the patient, generally just treat the underlying cause. Okay, anxiety is usually the main reason for alkalosis, so it's an easy disorder to treat generally. Treat the anxiety, possibly with slow breathing techniques or exercises to control the anxiety. Give the patient O2 if they need it. Also to paper bags. So paper bags are still in the textbooks. It is a historical treatment. Some people or textbooks or doctors say it doesn't help. It actually could make the condition worse. But other textbooks do state that you should try using a paper bag. So basically it helps to rise the CO2 levels. But it can also cause the patient to have hypoxia. And that's one of the concerns that they generally have with using a paper bag. It's not useful in other diseases that mimic hyperventilation. Okay, elevated CO2 can trigger panic attacks, worsening hyperventilation. Consider referring the patient for counseling, help with their anxiety episodes. So some medications that we can use, relevant medications, do include anti-anxiety medications, may be required to calm the patient down and decrease the respiratory rate. Patient education would include teach the patient relaxation techniques, benefits of stress management. Keep aspirin and other salicylates out of the reach of children, and follow the correct poison control guidelines if exposure occurs. So if they've had an excessive amount of salicylate. Maintain safety protocols and measures, especially in the patient who's experiencing neurological effects. Teach the patient to seek help when needed to deal with anxiety episodes or to decrease the episodes' stress management. They may need routine counseling. So those are some things you want to think about. Diagnostic testing. Again, ABGs would be one of your main diagnostic tests to perform in a patient who you may be assuming has respiratory alkalosis. So ECG basically is going to help. Some of the other tests to do with patients who have respiratory alkalosis would include an ECG, and that's just really to view the heart's conduction. You're looking at the heart rhythm, and that's really due to the secondary to the hypokalemia. Other tests to identify underlying cause, definitely tests to rule out infection. So that would include like your WBC count, chest x-ray, and so on. Okay, so failure to rescue. Remember, this means that the nurse has failed to respond to a clinical sign or situation resulting in a decline of the patient's status, possibly causing harm to the patient, maybe even a sentinel event such as death. So in each of our concepts and also our exemplars, I will talk about failure to rescue because it's so important that we realize when things are not right with our patients and we report it, even if we don't know how to treat it right then and there. Do what you can to manage this patient and report it until the appropriate people can help you. So when we look at respiratory alkalosis, what are some of the clinical signs a patient may experience when respiratory alkalosis is present? So we always got to think about those clinical manifestations. Hypokalemia, the patient has a low potassium level that could lead to heart dysrhythmias. They need to be on a cardiac monitor, right? Lethal rhythms possibly could cause the patient to have or go into like a cardiac arrest, in that, such as like VFib or ventricular fibrillation. Increase in the respiratory rate, the heart rate, a decrease in the BP. What about difficulty in breathing from exacerbation of tachypnea? The patient tires out. They can begin to become or have difficulty in breathing because they can no longer produce effective breaths. So that can happen definitely when a patient who's hyperventilating. Is this patient at risk of having a respiratory arrest? And that could happen, right? What do you do as a nurse? What is the cause? Fast assessment, investigation, and treatment are crucial. Again, it is crucial for the nurse to recognize when a patient simply doesn't look good, their oxygenation level is low, it's not lower than their baseline, it's not a normal level, or it's lower than that patient's baseline. Looking at their vital signs, what do they look like? Abnormal lab values, a deviation from the baseline, again, of the patient's assessment. So those are things that you want to look for. And this concludes the third lecture, the concept of acid-base balance, respiratory alkalosis. I look forward to seeing you guys in part 4. Thank you.